It's being called the largest healthcare fraud settlement in West Virginia history. Today, the United States Attorney announced the deal in a scam that preyed upon people in the Mountain State who have to be drug tested.
Hi, how are you?
A company known as Acadia Healthcare has agreed to pay penalties and fines totaling $17 million. Acadia and its subcontractors admitted overcharging for drug testing of clients at drug treatment centers across West Virginia.
Medicaid fraud is not a victimless crime. And I know there are a lot of folks that think because we're just talking about dollars, there's no victim. There are a lot of victims here, not only those folks who get Medicaid, but those taxpayers, all of us who pay into these funds.
Here's how the scheme worked. Drug tests were contracted at an average cost of $4 per patient. But when the company billed reimbursements to Medicaid, it charged $117 per patient. That totaled $8.5 million in overpayments before they were caught. Health leaders are upset because that money could have been used for prevention and drug treatment.
We do not have enough money to take care of this problem. The opioid problem and the substance use disorder problems in West Virginia are huge. They're the biggest public health problem this state has ever faced.
The U.S. Attorney says because Acadia Healthcare cooperated fully in this investigation and doubled the amount it owed, there will be no criminal prosecution. The state will receive $2.1 million, and the rest will go back into the federal Medicaid fund, which provides health care to low-income patients.
When you look at all these treatment centers across West Virginia and their penalty, on top of the $8.5 million reimbursed, a penalty of $8.5 million, that's a substantial penalty.
The fines will be paid to West Virginia and the feds within 5 days. By the way, the U.S. Department of Justice now estimates that Medicaid fraud costs U.S. taxpayers $40 billion each year.